Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about low blood pressure or hypotension, understanding the drops. What is low blood pressure? Blood pressure is measured in millimeters of mercury with two numbers. The systolic top number, which is the pressure when the heart beats, and the diastolic bottom number, which is the pressure when the heart rests between beats. Low blood pressure is typically considered a reading lower than 90 over 60. It's important to understand that what's considered low for one person might be perfectly healthy for another. For example, athletes often have naturally lower blood pressure. Most healthcare professionals consider blood pressure to be problematic only if it causes symptoms. Recognizing the signs, dizzy or lightheadedness feelings, especially when standing up quickly, fainting or syncope, a sudden brief loss of consciousness, blurred or fading vision, a temporary visual disturbance, fatigue, a general feeling of tiredness or lack of energy, trouble concentrating, difficulty focusing or thinking clearly, upset stomach, nausea, or other digestive discomforts. It's particularly concerning when blood pressure drops suddenly or if these symptoms appear abruptly. A change of just 20 millimeters of mercury can make you feel dizzy or faint. In severe cases, extreme low blood pressure can be life-threatening and lead to a condition known as shock. Shock is a medical emergency where organs are not getting enough blood flow and oxygen. Symptoms of shock require immediate attention. Confusion, especially noticeable in older people. Cold, clammy skin. The skin may feel unusually cool and moist. Decrease in skin color, pallor. Skin may appear pale or grayish. Rapid, shallow breathing. Breathing becomes fast and less deep. Weak and rapid pulse. The pulse is faint but very fast. Causes. Low blood pressure can stem from a wide range of causes, from simple, easily reversible factors to serious underlying medical conditions. It's crucial to identify the root cause for appropriate treatment. Some primary causes include dehydration, one of the most common causes due to insufficient fluid intake, vomiting, diarrhea, or fever. Hemorrhage, significant blood loss from injury or internal bleeding. Cardiac causes, problems with the heart's ability to pump blood effectively, such as heart failure, heart attack, or arrhythmias or irregular heartbeats. Severe infections, sepsis, overwhelming infections can cause a dangerous drop in blood pressure. Severe allergic reactions or anaphylaxis, a sudden widespread allergic response. Endocrine problems, conditions like Addison's disease or thyroid disorders can affect blood pressure regulation. Medications. Many common medications can cause low blood pressure as a side effect. For instance, diuretics, some blood pressure medications, certain antidepressants, and erectile dysfunction drugs. Types of low blood pressure. Orthostatic hypotension or postural hypotension. This is a sudden drop in blood pressure when standing up from a sitting or lying position. It's very common, especially in older adults, and can be caused by dehydration, prolonged bed rest, pregnancy, some medications, and certain medical conditions. Postprandial hypotension, a drop in blood pressure occurring 1 to 2 hours after eating. It's most likely to affect older adults, particularly those with high blood pressure, Parkinson's disease, or conditions affecting the autonomic nervous system. Neurally mediated hypotension, NMH, a blood pressure drop that happens after standing for prolonged periods. This type mostly affects young adults and children and may result from communication issues between the heart and the brain. Less commonly, low blood pressure can be a feature of rare, complex neurological conditions, multiple system atrophy with orthostatic hypotension, also known as Shy-Drager syndrome. This rare progressive condition affects the autonomic nervous system, which controls involuntary bodily functions. It's specifically linked with having very high blood pressure while lying down, followed by significant drops when standing. This condition represents a severe form of autonomic dysfunction. Identifying these rarer types often requires specialized neurological evaluation. When to see a doctor and what to do. When should you be concerned about low blood pressure? If you have symptoms of extreme low blood pressure or shock, call 911 or your local emergency number immediately. Most healthcare professionals consider blood pressure too low only if it causes symptoms. If you experience dizziness, lightheadedness, fainting, or other symptoms frequently, it's important to see a healthcare professional to find out the cause. Minor occasional dizzy spells, for instance from too much sun, might not be a concern, but persistent symptoms need evaluation. If you feel often you have low blood pressure readings but feel well, you might not need treatment. Your healthcare professional will likely monitor your health during routine checkups. It's helpful to keep a record of your symptoms, when they occur, and what you're doing at the time. In conclusion, low blood pressure or hypotension is a diverse condition. While it may be normal and asymptomatic for some, it's crucial to identify and address its cause if symptoms appear. Remember, hydration is key. Drink plenty of water, especially if you experience orthostatic hypotension. Lifestyle adjustments. For postprandial hypotension, try small, low carbohydrate meals and avoid alcohol. Medication review. Always discuss potential side effects with your doctor. Prompt medical attention. Don't hesitate to seek emergency care for severe symptoms. By understanding the types and causes of low blood pressure, we can better manage our health and address the drops effectively. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to my